I'm Cara DeGroat. I'm a nurse practitioner here at the Janning ENT Center, and I work with Dr. Mellema and Dr. Janning. And I'm here to talk a little bit about sinuses today. So this time of year, we have lots of people that have concerns with their sinuses, or they may say, I have sinus problems. And that might mean a lot of different things. It might mean allergies, seasonal allergies in the fall are certainly a problem for a lot of people. It could be even that they have allergies to their pet and they don't realize it, so they're having chronic infections. People typically that are exposed to smoke or are smokers have more recurrent infections, sinus infections specifically. And also we're getting into virus flu season, so you're going to have more colds, which produce mucus buildup, clogging, and people can feel that within their sinuses. Not always do sinuses need to be treated with surgery. Not always do sinuses need to be treated with antibiotics. So all of that we can help you with when you come in. We can talk through that. Sometimes it really is an allergy concern. Sometimes a sinus rinse, which you can get over the counter, can be really helpful just to clean everything out. This is kind of a sinus picture here, so it helps a little bit to understand, well, why would shoving a rinse up through my nose help my sinuses? You have sinuses here, you have maxillary sinuses, your frontal sinuses, ethmoid, sphenoid sinuses are in through here. So all of those kind of connect and drain into your nose or down your throat. You blow your nose, it can come out, you swallow, you cough, etc. So the sinus rinse can help clean out these areas, specifically if you have a cold or allergies. Some people will do that every day. Some people will do a sinus rinse every day just to clean everything out, specifically with chronic allergies. If you're having multiple sinus infections per year, then again, we may have you see an allergist. We may check a CT scan, so we might want to look a little bit more imaging wise to see what's going on in the sinuses, make sure that you need to be on those antibiotics that many times a year, and then also consider sinus surgery. Now oftentimes with sinus surgery there may be other things going on as well. We've talked about that in some previous videos. Something like a septoplasty, if this middle part of your nose is crooked or bent or turned, can cause some nasal obstruction and congestion. Certainly these turbinates, if they're swollen on the side here as well, can cause a lot of swelling, congestion, and difficulty for the sinuses to drain. Those can be trimmed in a surgery, and sometimes all of those surgeries along with sinus surgery can be done at the same time. Again, we need to decide that. You need to decide that. What's the best thing for you moving forward? So that's where we would welcome you to come in and talk with us about things that we can do to help decrease how often you're getting sinus infections. Of course, if you have any questions or concerns, if you're looking to schedule an appointment, please give us a call at 320-231-EARS and set up an appointment. If you're concerned about needing a consult, sometimes patients will need consults. It really depends a little bit on their insurance, so your primary care provider can make that appointment for you as well. But feel free to call our office and contact us anytime.